Who may be a candidate for TMS? This is the next question. If you only remember one thing from today, I hope that this is it. TMS has gained significant scientific ground since most of us have graduated. It is now FDA approved for adults with depression who have failed one or more medications. It is now also the official recommendation of the APA that TMS be considered at that time. That is much earlier in the treatment hierarchy than I think most psychiatrists are aware of, and it reflects the building evidence supporting TMS. TMS is also FDA approved for adolescents ages 15 to 21 as an adjunct treatment. Let me say that again, ages 15 to 21. This is a huge area of need where only a few medications are FDA approved, and many children and parents prefer a drug-free option. This new standard for TMS also just applies to a lot of people. About 2/3 of patients with MDD are not satisfied with their current treatment. About 1/3 are considered treatment resistant. So in my practice, if a patient has failed a medication or two, I am no longer providing the standard of care if I'm not also considering other evidence-based options like TMS or like structured therapy. TMS is also a drug-free option for patients more vulnerable to side effects, children, seniors, complicated medical patients, or patients who simply aren't interested in a daily medicine. I'm sure we all see those folks. Although today is more of a brief overview, NeuroStar TMS is also FDA approved for 2 additional psychiatric indications in adults. These are MDD with co-occurring anxiety and OCD. All indications have unique target location, protocol, and dose. Who is not a candidate for TMS? Well, there's only one absolute contraindication. You can't have any magnetic metal in your head or your neck. Why? Well, the TMS field could potentially move or heat that metal. But it doesn't mean all metal. Most titanium, which isn't very magnetic, is fine. Most modern dental hardware is also fine. So in reality, it's more of a careful clinical decision, and sometimes we do a lot of looking up too, just to make sure. There are also a few relative risks we consider. That means you'll probably still be able to have TMS, but it's important for me to get more information first. I always ask about stroke, brain tumor, seizures, serious head injuries, or metal in the chest like a pacemaker.